Okay, so you guys have sent in some really fascinating stuff about CBT, cognitive behavior therapy. And what we're going to try to do today is really kind of distill it down. What are the real key components of CBT? How does it work? What are some of the techniques? And then, really importantly for all of you out there, how can you use this as nursing students, in your practice, in your studies? We want to make sure that by the end of this, you feel like you have a grasp on CBT.
Yeah, I mean, you really gave us a lot of material to work with. And it's really interesting, especially the idea that, our thoughts, our feelings, our behaviors, they're all really connected. And CBT really tries to harness that and help us understand that connection.
So to get started, like, what is CBT? What is cognitive behavior therapy?
So it's a type of psychotherapy. And it's really structured. It's very goal-oriented. And the idea is that our thoughts, they really influence our emotions and then also our behaviors.
Hmm.
So the goal is to try to identify any negative or unhelpful thought patterns, and then you work with the individual to help them change those, and hopefully that leads to better emotional well-being.
It's not just about like thinking happy thoughts.
Yeah.
It's actually about changing these ingrained patterns. And it's based on the idea that thoughts, feelings, and behaviors, they're all linked together.
Yeah, exactly.
Yeah.
I mean, it's almost like a cycle, right? Like you have a negative thought, and that can kind of trigger a negative emotion, and then that leads to maybe a behavior that's not so helpful.
Mm.
And so, for example, say you're a nursing student and you're about to start your clinical rotations and you have this thought like, oh, I'm going to mess this up.
Mm.
That might trigger anxiety. And then maybe that makes them avoid asking questions or participating fully, and that could actually affect their learning experience. And so CBT tries to get in there at the beginning at the thought level.
Yeah. So where did all this come from? Like, who were the people who were really influential in developing these ideas?
So the two big names, you got Aaron Beck, who developed cognitive therapy.
Mm.
And what was really interesting about his work was how he really started to understand depression through this lens of how we think, our cognitive processes. And he identified these negative thought patterns, these recurring patterns that he saw in people with depression. And he called these cognitive distortions.
Oh, cognitive distortions. We're definitely going to come back to those. Those sound important. What about the other person you mentioned, Albert Ellis?
Yeah, so Albert Ellis, he developed rational emotive behavior therapy, which is also known as REBT. And so his focus was also on thoughts, but he had this model that he called the ABC model.
Okay, so tell us about that. What is the ABC model?
Okay, so A stands for activating event. So think about a situation, something that happens that triggers a reaction. B is for beliefs, and so that's your thoughts, your interpretations, what you think about that event, your assumptions. And then C is for the consequence. And so that's your reaction, either an emotional reaction or a behavioral reaction. And so what he realized was that it's not the activating event, A, that directly causes C, the consequence, but it's your beliefs about that event that really drives the consequence. It's that internal dialogue.
Okay, so we've got two different people, different frameworks, but they're both really focused on the power of our thoughts. What are the main goals of CBT? What are you trying to do when you're working with somebody using this approach?
So really one of the big goals is to help individuals become more aware of their own thought patterns and how those were actually impacting their lives. And then once they kind of have that awareness, it's like, okay, what are those specific thoughts that are making you feel distressed or, leading to behaviors that you might want to change? And then you work with them to kind of challenge those thoughts and to try to replace them with ones that are more balanced, more helpful, more realistic. And then also another big goal is to, especially when you're working with things like depression, you want to increase what we call behavioral activation. So encouraging people to start re-engaging in things they used to enjoy or things that give them a sense of pleasure or accomplishment or even just connecting with other people. And then overall, the goal is to provide individuals with this set of coping skills so they can better navigate life's challenges.
So it's like awareness, then you start making changes, and then you build this toolkit of coping mechanisms. Now, you talked earlier about cognitive distortions. Can we break down some of these thinking errors that people make?
Yeah, totally. So cognitive distortions, they're these flawed or inaccurate ways of thinking, and they can really fuel negative emotions and unhelpful behaviors.
Yeah.
So one example is all or nothing thinking. And so this is that black and white thinking, right? It's like either things are perfect or they're a complete failure. There's no in between. So for example, you might have a nursing student who thinks, if I don't get an A on this exam, I'm a total failure.
Yeah.
Right. And so there's no room for like, okay, maybe I didn't get an A, but I still learned something and I can still improve.
Wow. That's a lot of pressure to put on yourself. What else? What other distortions are there?
So another one is overgeneralization. And so that's when you kind of take one negative experience and you apply it broadly to all sorts of situations. So maybe you're a nursing student and you get some feedback on an assignment, some constructive criticism,
Hmm.
and they start to think, oh, I always mess up when it comes to patient care.
Yeah.
And so they're taking that one experience and they're overgeneralizing to everything they do.
Yeah.
And that could be really damaging to their confidence. And it's probably not accurate.
Okay, what else?
Okay, so then there's mental filtering. And this is like you put on these glasses and you can only see the negative. So it's like, maybe a nurse gets a ton of positive feedback, but then there's one little thing that they could improve on, and they just focus on that one negative piece of feedback.
Yeah, it's like all the good stuff gets ignored.
Right, exactly. And then, kind of along the same lines, is what's called disqualifying the positive. And this is even worse. So this is where you're actively dismissing positive experiences or accomplishments.
So if somebody says, hey, you did a really great job, you're like, oh, no, 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 it was nothing.
Yeah, exactly. Like, oh, they're just being nice, or, oh, I just got lucky, and so you're not letting yourself take credit for anything good.
Yeah, it's
Yeah.
almost like self-sabotage, right?
Yeah, it is. And then another one is jumping to conclusions. And so this is when you just assume you know what other people are thinking, or you predict the future and it's always negative. And so there's two types of this. Mind reading, where you assume you know what other people are thinking.
Right.
So, oh, all the other nurses think I'm so slow. And then there's fortune telling.
Yeah.
And so that's where you predict negative outcomes. I'm definitely going to fail this skills check.
Like you already know what's going to happen and it's bad.
Exactly.
So you're kind of making up this negative story, even though you have no idea what's going to happen.
Yeah. And then there's catastrophizing. And so this is when you take something small and you just blow it up into this huge, horrible event.
Oh, like if I forget to chart this one thing, I'm going to get fired and lose my license and I'll never be a nurse.
Yeah, exactly. And it's like, that's not going to happen, you know? But in their mind, it's like this huge disaster. And then there's emotional reasoning. And so this is when you just assume that your feelings are facts. So maybe you're feeling anxious. So you think, well, I must not be prepared.
So if I feel it, it must be true.
Exactly. But feelings aren't always facts. And then there's labeling, which is where you kind of put these negative labels on yourself or other people based on one little thing.
Like, I made a mistake, so I'm incompetent.
Exactly. And those labels can be really hard to shake.
Yeah.
Okay, what's the last one?
The last one is personalization. And so this is when you take responsibility for things that are outside of your control.
Oh, like the patient isn't doing well, it must be my fault.
Yeah, or, the family's upset. It must be because of something I said. And it's like, you can't control everything.
Wow, it's really fascinating to see all those different ways our thinking can go wrong.
Yeah. And, these distortions, they really can contribute to all these negative feelings.
Like anxiety and sadness and anger. So just being able to recognize them can be so helpful.
So we've got these distortions, and then you mentioned automatic thoughts. So how do those fit in?
Yeah, so automatic thoughts are like these little thoughts that pop into your head all the time, and they can be irrational or not helpful, and we don't always even notice them, but they can really affect how we feel. And a lot of times they're based on these underlying cognitive distortions. Like, you walk out of a social situation and you automatically think nobody likes me.
Yeah.
And that thought just comes out of nowhere, but it can really drag you down.
Yeah. It's interesting how you can have a perfectly nice time and then walk away thinking something totally negative.
Exactly.
Okay, and then what about core beliefs? Those sound pretty deep.
Yeah, core beliefs are like these fundamental beliefs we have about ourselves, about the world, about other people. They kind of develop early on in life, and they can be pretty hard to change, and they can really drive a lot of our thoughts and behaviors. So for example, if you have a core belief that you're not good enough, that might lead to all sorts of automatic thoughts like, I'm going to fail or I'm not lovable. And then that can lead to behaviors like avoiding challenges or constantly seeking approval from others.
So you've got these core beliefs way down deep, and then they feed into the automatic thoughts and then the distortions. Okay, so what do you actually do in CBT? What are some of the techniques?
So there's a whole bunch of different techniques, but one of the most important is called cognitive restructuring.
Okay.
And it's also known as reframing. And so the idea is that you take a negative thought and you really examine it. Like, what's the evidence for and against this thought? And then you try to come up with a more realistic, more balanced, and hopefully more helpful alternative thought. So instead of thinking, I'm going to fail this exam, you might think, okay, I studied really hard, so I'm as prepared as I can be.
Yeah, so you're not trying to pretend everything's perfect, but you are trying to look at it more realistically.
Exactly. And then there's this technique called Socratic questioning.
Okay.
And so this is where the therapist, instead of telling you that your thought is wrong, asks you a bunch of questions to help you kind of figure it out on your own.
Oh, interesting.
So questions like, okay, what's the evidence for this thought? Or what's the evidence against it? Or is there another way to look at this situation?
So you're kind of guiding the person to their own insights.
Exactly. And then another really cool technique is behavioral experiments. And so that's when you actually go out and test your beliefs in the real world. So say, for example, you're a nursing student and you're really afraid to ask for help because you think people will judge you.
Mm-hmm.
So you might do a behavioral experiment where you purposely ask for help in a low-stakes situation.
Yeah.
And then you see what happens. And a lot of times, people are happy to help and they don't judge you. And so that can help you kind of challenge that belief.
Yeah, so you get to see how your fears might not actually be true. What about, if somebody's feeling really down or they're lacking motivation?
Yeah, so that's where activity scheduling and behavioral activation come in. And so the idea is that you schedule activities, even small ones, that you used to enjoy,
Okay.
or things that give you a sense of accomplishment. Because a lot of times when we're depressed, we just kind of withdraw and stop doing things that we enjoy.
Yeah.
And so this can help us kind of break out of that cycle. So maybe it's like, okay, I'm going to schedule a walk in the park tomorrow, or I'm going to call a friend.
Just something to kind of get you moving again.
Exactly. And then there's exposure therapy. And that's really helpful for people with anxiety disorders. And so the idea is that you gradually expose yourself to the things that make you anxious,
Okay.
but you do it in a safe and controlled way. So if you have social anxiety, maybe you start by practicing talking in front of a small group of friends, and then you gradually work your way up to bigger groups.
So you're kind of facing your fears little by little.
Yeah, exactly.
What about keeping track of all these thoughts and feelings? Are there any techniques for that?
Yeah, so a really common technique is using what's called a thought record.
Okay.
And so it's basically like a journal where you write down your negative thoughts
Okay.
and this situation, the emotions you're feeling, and then you really try to challenge those thoughts.
Yeah.
Like, what's the evidence against this thought? Can I come up with a more balanced thought?
Right.
And it really helps you kind of become more aware of those patterns.
So you can actually see it on paper and start to see, oh, I'm always thinking the same negative thought.
That's exactly.
Okay, what else?
Okay, so another important technique is relaxation training.
Mm-hmm.
And so that's really helpful for managing anxiety, stress. And so that might include things like deep breathing exercises, progressive muscle relaxation, mindfulness.
Okay.
And then there's problem-solving training, where you learn how to break down problems into smaller steps so they don't feel so overwhelming.
Okay.
And then a really important part of CBT is homework assignments. So it's not just what happens in session. It's also the work you do outside a session.
Like practicing the techniques.
Exactly. So, maybe you're practicing cognitive restructuring when you notice a negative thought, or you're doing a behavioral experiment.
So you're really taking it out into the real world.
Exactly.
So for our listeners who are nursing students, like how can you use this? What's the nurse's role in CBT?
So nurses actually play a really important role. I mean, you're on the front lines. You're interacting with patients all the time. And you're in this unique position to really help support patients who are going through CBT, or even to just integrate some of these principles into your care.
Okay.
So one of the most important roles is assessment, just paying attention, observing. What are those thought patterns you're hearing from patients? What are their emotional responses? What are their behaviors? You're picking up on all those things.
So you're listening for those cognitive distortions.
Exactly. And then you can also teach coping skills.
Mm-hmm.
So teaching relaxation techniques like how to do deep breathing exercises. You can also introduce the idea of cognitive restructuring. Just helping patients start to notice the connection between their thoughts and their feelings.
Yeah, even just planting that seed that, hey, maybe there's another way to think about this situation.
Yeah. And you can encourage self-monitoring. So, helping patients keep track of their moods, their triggers, maybe even writing down some of those thoughts that are bothering them.
So helping them to become more aware.
Exactly. And depending on your training and your role, you might even help facilitate behavioral experiments. So, encouraging a patient to test out a belief. And a really important role is just supporting patient empowerment, helping patients feel like they have some control over their own mental and emotional well-being.
So it's not just like, okay, here's what you have to do. It's about helping them understand their own thoughts and behaviors and how to change them.
Exactly. And then another role is just providing psychoeducation. So just explaining these concepts to patients in a way that they can understand.
So nurses really have a lot to offer. It's not just about the medication or the physical care, it's also about the mental and emotional side of things.
Totally.
So just to wrap it all up, what are some of the key takeaways?
Yeah, so we covered a lot, but I think the main point is that CBT is really a powerful approach. And it's based on the idea that, if we can change how we think, we can really change how we feel and behave. We talked about all those cognitive distortions, those thinking errors that we all make. And then we talk about some of the techniques like cognitive restructuring, behavioral activation, exposure therapy.
And the nurse's role is really crucial in all of this.
Totally.
Now, you gave us some materials that has some study tips, too.
Yeah, so there's this mnemonic to help you remember some of the cognitive distortions.
Yeah.
OMAC-GECLIP,
Okay.
which stands for overgeneralization, mental filtering, all or nothing thinking, catastrophizing, jumping to conclusions, emotional reasoning, and then labeling and personalization.
Okay. And then, just practicing. Right.
Yeah, practice identifying these distortions. Come up with examples.
Yeah, so you can spot them when you're out in the real world.
Exactly.
Yeah.
And really understand the ABC model because that's such a fundamental part of CBT.
Yeah. Okay, great. So I think this has been a really helpful deep dive into CBT. We talked about the basic principles. We talked about the people who developed it. We talked about all those thinking traps that we can fall into and all the different techniques and how nurses can use this in their work.
Yeah, and for you as a nursing student, I think this is so relevant because, you're going to be working with patients who are dealing with all sorts of things. And CBT can really help you understand them better and support them better.
It can also help you take care of yourselves.
Exactly.
So as you're going through your studies and as you go out into the world as a nurse, think about how can recognizing these cognitive distortions in yourself and in others, how can that impact your care? And how can that help you stay healthy and resilient in what can be a really tough job? If all of this has got you really interested, I would definitely recommend, checking out some more resources on CBT, maybe reading some of Aaron Beck or Albert Ellis's work.
Yeah, definitely.
All right. Thanks for joining us for this deep dive.